In this video, we're going to show you how to use the Broda chair, sometimes referred to as the Jerry chair. Now we're going to show you the recline feature of the chair. That's this upper handle, and the recline feature opens the back angle of the chair, and then once you hit a certain point, it lifts the legs, and it can go all the way back to flat. Okay, this is the tilt feature of the chair. It maintains the back angle and the footrest, but it tilts the entire chair in space. Just make sure when you're using these features and there's a patient in it that you always lock all the brakes. So I'll show you this. Okay, so the last feature is the leg rest feature. And there's actually a little lever here that can control that one, which isn't quite as important, but it's good to know where it is. Okay, so this is our patient, Mrs. Jones, and we're going to demonstrate each of the features of the chair with someone in it and explain kind of when you would use each one. So first of all, Mrs. Jones is sitting at 90 degrees, so that's the recline function, her back angle, and that's pretty uncomfortable. Most of our patients don't even have that hip mobility. So I'm going to sit her back in the recline a little bit, because that will make it more comfortable for her sitting posture. And then just for demonstration purposes, I am going to put her all the way back, so just so you can see what that looks like. If you can see her feet come up. The recline feature, though, does not relieve any pressure on the ischium in and of itself when you use it. So that's why we have the other features. Okay, so for pressure relief for patients that are not able to reposition themselves, we're going to use the tilt feature. So that's the lower one. Keep in mind, you always want to let your patient know when you're going to press one of these buttons, because sometimes it can happen a little quickly, and also they might not remember or know that they're in a chair like this that has so many positions. So I'm going to press the tilt feature, and the chair tilts. So if you can see, this is tilted all the way down, but when it tilts, it actually relieves the pressure on the ischium, and she has more pressure on her back, so it relieves that pressure. It's recommended that every 30 minutes they sit for at least 5 minutes in this position, in a tilted position, to relieve that pressure. Okay. So some of our patients are going to have different preferences for their comfort level sitting in the chair, but just keep in mind that most of the time, or all the time, you're going to be using the tilt function for pressure relief. So the other one is the recline, and so for her, for example, we have a patient that kind of laterally leans to the right. So if this person is sitting up for a long time, he starts to lean this way. So I can recline him back a little bit and then help him readjust his shoulders and have him relax his head back, so that he knows he's supported. And then, so in this instance, his feet are up enough. I could ask him if he wants his feet up higher, and then when it's time to relieve his pressure, for the pressure relief, I would tilt him back in that position. What we don't want is patients to be sitting in this chair in a completely reclined sleeping position, because that's just a dignity issue. So at that point, they should just be put to bed. If you have any other questions, come and ask us in the therapy chair.